CRA is honored to have Dr. Tia Dole as our keynote speaker today. Dr. Dole is the Chief Clinical Operations Officer at the Trevor Project, the world's largest organization for suicide prevention for LGBTQ youth. Dr. Dole oversees all of the Trevor Project's crisis services programs, as well as the volunteer community on Trevor Lifeline, Trevor Text, and Trevor Chat. Dr. Dole is a licensed clinical psychologist and a longtime advocate for LGBTQ rights, with a specialty of LGBTQ people of color. Dr. Tia Dole will be joining us via audio so you can see her slides a little better, a little larger, and then we will turn on her camera for the Q&A portion at the end. Dr. Dole?
Can you hear me okay?
Yes, I can.
Okay, great. Thank you for that lovely introduction. And I also would like to be reached out to as well. I'm going to actually start, this is a keynote speech, but I don't know about y'all, but I have been sitting passively in a lot of conversations. And so I do have an ask of folks before we start the conversation, which is that please do be active in the chat. I'm able to multitask when I'm giving a talk, and I actually would prefer that some of this be an actual conversation rather than just sort of me speaking into the ether. I can't see you all. Right now, you can't see me, and it's sort of, I want this to be interactive as much as possible, particularly given, our set of circumstances being fully remote. So that is my one ask of you. At the end, we'll be having a Q&A portion of the conversation, but I'm super curious to hear about what folks are thinking and feeling, and I will be asking some questions, so I'd love for people to participate if at all possible. Thanks, Travis. So I'm going to start out by, our conversation today is about intersectionality and identity. And before we jump into that very large conversation, here's a picture of me so you know what I look like. And I actually thought, well, I wonder if this conversation should start talking about my identity as a person. It's, within a room full of strangers, a virtual room for a stranger. I'm a psychologist by training. I run our crisis services at the Trevor Project, and I'm a psychologist who began her career as an early psychosis person. So I don't know if there are other early psychosis people in the room who love working with young people who are in their first break. Please say so in the chat. But I also am a Black woman. I am a parent of two children who are much bigger than me, two girls. And I'm a New Yorker. I'm a Harlemite. I live in Harlem. And I think I'm starting out with this sort of like personal information, relatively speaking, because I think when we're talking about identity and we're talking about intersectionality, it's not just about race. It's not just about sexual orientation. It's about all the things that make us who we are. And I think it's really important that we sort of frame it. Thank you, Brenda. That we sort of frame it from who we each are as a person. So later on, I'm going to be asking folks to drop in the chat what is a meaningful part of your identity, and I'll let you know when to do that because I want to hear what you all think. But I will say that this conversation is really going to be framed in the context of LGBTQ youth with a sort of drill down with LGBT youth of color. That is my specialty. So I will refer to that population more than other population, but I really do, I'm so glad people are in the chat. I really do want everybody to understand that all the concepts, all the things that I'm talking about apply across the board. I'm just thinking it's important to use an example, what Rania was talking about. Examples, I think are probably the most meaningful way of learning something new. So I'll start out talking about the Trevor Project. I'll start out talking about my framework, and then we'll go on from there. So Trevor Project, we have a Trevor Lifeline. We have Trevor Text. That's a short code essentially, where young people text us And then we have Trevor's chat. And it's interesting because on our lines, the young people skew older on our lifeline and people skew younger on our text and chat, which is no surprise. I don't know about y'all, but my kids have no interest in talking on the phone. But so the people who do chat with us tend to, tend to be a little bit younger. And so we offer this crisis services. This is the heart of the Trevor Project. If we were to get rid of everything, then the only thing that would remain would be crisis services. But we do have other things that we do. So we have something called Trevor Space. I don't know if people have heard about it. It's essentially Facebook for LGBTQ young people between the ages of 13 and 24. And this is actually a space where young people talk, offer support. It's really quite lovely to see young people reaching out to each other and talk about, I'm nervous about coming out to my mom, or I'm really struggling with my identity. Can I still be Christian and be queer? All those questions are asked on Trevor Space, and it's a peer support. Super interesting. We have about 200,000 kids who currently use it. Kids. You can't see my air quotes. We also have a research team. Our research team conducts, the biggest thing that we do is conduct a national survey. Last year, I believe it was 32,000 kids participated in it. That's actually a huge part of what we do because there isn't a ton of research in the LGBTQ community. And we also have our advocacy team. They're actually in Washington and work on both sides of the aisle. We're a nonpartisan organization to pass laws that protect LGBTQ youth. Probably our biggest program that we're working on right now is 50 Bills, 50 States, which is banning conversion therapy across the United States. We know it's a super, super dangerous practice and one that we are working to eradicate. So I actually don't call it conversion therapy. I call it conversion efforts because therapy implies that something is helpul or therapeutic, and it's not. We know that 50% of kids who go through conversion therapy make a suicide attempt within 12 months post conversion efforts. And then finally, we have Trevor Education. So we do lots of external speaking. We partner with other organizations, like we're partnering with Puma, we partner with the NFL, and we try to enter spaces where queer folks are not seen or heard and change people's minds. And I think that's about it for our programs. Okay, so one of the things I think is important is that when we're thinking about LGBTQ folks in general, like I said, I'm just using this population as an example to talk about intersectionality, but I think it's important for you to see where I'm coming from. We know that LGBTQ young people report attempting suicide 4 times the rate of non-LGBTQ youth. And that's a staggering statistic. And on top of that, 40% of LGBTQ youth seriously considered suicide within the last 12 months, and more than half of transgender and non-binary youth. So meaning about half of kids who identify in this community are seriously considering suicide, and not just in passing, but kind of coming up with a plan, intent. Why the name Trevor? So there was this very cheesy movie in the 90s called, what was it called? It was it was starring a young person named Trevor. And when they were making the movie, at the end of it, they were about to post it, and they thought, oh my goodness, we need someone a hotline. And that's how Trevor Project was developed. And yes, we know that 1.8 million LGBTQ youth are seriously considered suicide each year. We are currently serving about 200,000 kids a year. And many of those people are reaching out to us in crisis. And so we know that this is actually a serious problem. And it's one that we're working to address. Okay, so introduction. We're going to jump into the meat of this. And I love the activity in the chat. We're going to talk about why identity matters, what can happen when we pretend it doesn't. We're going to talk about bias and microaggressions, and then what you can do, how you can be an ally, and any questions. And I'm going to start with identity. Okay. I don't know if any other people noticed that the last 8 months have been, I'm going to use the word interesting, but pretty horrific. And I'm going to frame this from the perspective of a young person, because I'm always thinking about young people, is that when we all got pulled into our homes during COVID, there's a different experience, right? I think I got pulled fully remote on March 13th. It sticks out to me because it was right before my birthday. And I don't know about y'all, but it was a big shock for me. But what it is a shock is how this impacted different populations. People who were at school or living on their own, away from their family, who are suddenly being placed and to potentially dangerous situations. And I'm framing it this way because who you are, your identity impacts how the last 7 months have affected you, right? So if I'm a sort of middle America, I'm a middle-aged Black woman. COVID really affected me. I knew people who were sick, but during the summer when we were sort of having the social justice uprising, and that's how I'm going to frame it. It was a real shock to the system, and I think for me personally, I felt a lot of grief over what was happening in the United States. And so, one thing that I always frame the identity conversation is the way we view ourselves in relation to others and in relation to the broader society. So I think when we're talking about identity specifically, it's who you are. How are you in relation? And I cannot define for you what your identity is. But I think I don't know if you've thought about how you identify. So when we're talking about intersectionality, is really the interconnected nature of everything, right? Race, class, gender, all these things sort of overlap. And I don't think that we necessarily even talk about class as much as we could in relation to how COVID has affected. I can work remotely. I can work from home. I am so lucky that I can work remotely, that I still have my job, that I work in the healthcare field where we are always needed. So I'm going to pause for a moment and I'm going to give people a chance. And remember, I'm a psychologist, so I can sit in silence, but I don't want to. Can people drop into the chat what is most important to them in terms of their identity? So I'm going to wait. And I'm going to ping Travis first. I know silence is hard. Family. Okay, good. Thank you. Family, musician, creative. Okay. God and family, values and religion. Great. So good, more is coming. Yay. Thank you, everybody. I know it's hard to put yourself out there, especially with strangers. So family matters. I'm seeing faith, culture, connection, friends, family, sobriety, family and music, professional care, family, fatherhood, husband, family, faith, family. One thing I'm seeing is Blackness, faith. It's interesting. This is so amazing. There are a lot of themes here. Let's say someone said something sort of interesting. Feels like it changed depending on the time, for sure. Day to day, this can change. I love all of this participation. Thank you, everybody. Right. There are so many different ways, but one of the things I see probably more than anything is family. But when you think about specifically for the LGBTQ community, when you come out, oftentimes your family is disrupted from you. And so it's the thing that's most important to you may not be available. I like this, Lauren's emotional health is so important. So I'm going to go to my next slide, which is all about different identities. And it's super small. I hope I didn't make it way too small for folks to be able to see. But you can see in the center here that your identity is potentially spirituality, religion, how you look. I'm actually 4'11", and it sounds a little kooky, but me being a super short person is a big part of my identity. I don't know why, it just is. It's something that's always been there. But we can see that all these things are intersectional. oftentimes family and religion are very tightly wound. And I think if you look at this graph here, what you can see is that all these things kind of go into your identity. Thanks, Amina. A lot of these things go up, but some of the connections are shaky. Some of them are blurred. Some of them are fractured, and some of them are super strong. And so when we're thinking about folks in crisis, and this is the center back into our today's conversation, when we think about folks in crisis, each person that is coming in front of you has this web of identity. However, and I'll talk more about it in a second, we often see people distilled into one or two identifying characteristics. And I'm going to ask folks to think now, because I'm going to ask a question later about when people have made assumptions based on identity. And that's going to be a harder question to ask. And I will be vulnerable and share my own experiences. But I think when you think about this web, and this is a very small web compared to what is true, is that we see people in crisis as one or two things because we are in a rush. We have a huge caseload. Let's say if you're in the ER, if you're in a residential setting, we out of necessity take shortcuts so that we can do our jobs. And this conversation today is, how do we find time in our workday to see people beyond the one or two things that are most salient to me? So I think a few people said that faith mattered to them. So for you, you may be biased in saying, I'm curious about this person's faith or asking them about their faith. Or family is so important to me, so I am more curious in my intake conversation or in my session to ask about their family relationships. Sexual identity might be in. So you see how these things go. I think we as individuals, we're human beings. And it's so interesting because someone here, a couple of people, like when Lauren was mentioning, and Amy agreed with the fact that emotional health, I am aware that everybody in this room, this virtual room, is probably like a super nice person because y'all are helping other people with your careers. You could do anything, right? You could be oriented towards making money, but instead everybody here is here because they want to help people. And so to me, that makes you a special person. That makes you a new type of person. But we're also human, and we tend to focus on what is matter. So I want you to take a moment. You don't have to put it in the chat. When you're meeting someone new, wherever type of service that you work, what is the first thing that you notice? If you want to drop it in the chat, that would be great. If you don't feel comfortable, that's okay. I just want you to have that sort of conversation because this is a conversation with both me and yourself and with your peers here in the room. So what do you notice first? And I can say, as a clinician, I think it's because of my early psychosis experience. I notice whether or not I think someone has psychosis. It's something I always look for, especially in a setting. So, Lauren, you're saying, would love for terms like schizophrenic and autistic, let's define people and stuff. Yes, I agree. I agree 100%. Using them as adjectives. No, we want to describe, right, experiences rather than call people names, right, in a way. Okay, so thank you so much for participating. I know that that's actually a hard thing. And I also notice race. This is something, I'm a Black woman. I notice if I'm the only, like, let's say if I'm somewhere and I notice I'm the only Black person here, or, there's different ways that we engage in other people's identity. So I do want to flag it out. So why does identity matter? Well, there's a million and one reasons, but who you are determines how you are treated. I know this to be true. I used to be, before I was at the Trevor Project, I worked as a director of psychology at a large New York City hospital. I agree, Amina. I knew I could see how people would treat. I saw how I was treated. So I was a director of psychology. I would come onto the unit, and people would be like, "Oh, are you the social worker?" I'm like, "No, I'm the director here." From anybody, residents, from anybody, and I think it was always a shock. And I understood that this is how humans organize their world, but it was challenging. And then I think about the patients, right, or clients. I'm going to use clients today. And everything about our healthcare system is dependent on identity. So based on my experiences, I used to run an early psychosis program. I worked in many hospitals and things like that. And one thing I did notice is that, for instance, who you are determines what type of medication you have, right? So if you're someone who's on Medicaid and you're someone who's actively psychotic, you know what? You're probably going to get Haldol. Oh, thank you for sharing, Laura. You're going to get Haldol. You might get sort of a first-generation antipsychotic. But if you have private insurance, you're having your first break and you're relatively in control. You're going to have Abilify rather than Zyprexa, right? And so we know that medication is determined by identity, who you are, how much money you have, and even when you come on the unit. At least for me and the places I've worked, right? We used to have college students who would pop up on our unit sometimes, and they were treated differently. And it's you unconsciously, even myself would do it, right? Which is that you have more hope for someone who comes from a family that's stable. You feel like, okay, they're going to be okay, versus someone who comes from a really unstable background, things like that. And these are unconscious things that we're doing. We're going to talk about the unconscious in a second. And I promise not to make this a lecture. I promise. I also like to note in the chat that people are noticing. People notice race or gender first, affect second. Some people are noticing. So I really appreciate that transparency. So medication, diagnosis. So there's a study, Minsky et al., I'm blanking on the year, did this study, which is they gave a bunch of psychologists, and I'm a psychiatrist, and by a bunch, I mean like thousands of psychiatrists, 3 different vignettes. The only difference in the vignette was race. So they described behaviors that the person was experiencing, and they changed it from Black. They said the person was Black. They said the person was Latinx. Of course, they said Hispanic at the time. And then the person was white. When they did all the analysis of the outcome of the study, is if the person was white, they were diagnosed with bipolar disorder. If the person was Black, they were diagnosed with schizophrenia. And the person was Latinx, they were diagnosed as MDD with psychotic features. Same description, everything exactly the same. The only difference was race. What that says is that your identity, your racial identity in the United States determines your diagnosis. Diagnosis determines your treatment, determines your medication, and it determines whether or not people have hope about your outcome. And so the reason why I'm flagging this is that people are biased. And, I have like lots of thoughts about why this might be the case. I think it's about hope. I think it's about resources and things like that. And I don't think people are ill-intentioned. I just think that this is something that happens. So also safety. Now, this is an interesting question, which is like, well, how do race and ethnicity matter in the healthcare system, or how do different intersectional identities matter in a healthcare setting? I have seen, based on people's physical size, you'll see if you have to call in the police or the hospital police or whatever type of security that you have, they will be more aggressive, physically aggressive towards people with different body types, different skin tones, different genders. And so depending on who you are and how you appear to other people, you are far less safe in a crisis setting. And I don't know if folks have ever seen anybody become assaultive or something like that. If you see that happen in real time, it's really scary. And if you see a small person, you feel differently about let's say, an intervention. So I'm pointing this out also because specifically for the LGBTQ community and the trans community, safety is a huge problem in healthcare settings. I have seen, I've seen a lot, but I have seen, and I'll give an example of a young person who comes in, their pronouns are she, her, hers. They are born, they were sort of assigned male at birth, and I've seen nurses say, ugh, these people, and they end up in rooms with men, and they're actually in physical danger. And so it's oftentimes a cultural thing. I think that depending on who's on the nursing staff, I've seen nursing staff deliberately use the wrong pronouns because they didn't agree with the client's perspective or their client's gender identity, use the wrong pronouns, which then could put that person in danger. And so I do like to flag this and use this as examples of things that I've seen myself. And then also perception. And this kind of goes back to diagnosis. And y'all tell me if I'm talking too much. When it comes to perception, I think a lot about hope. And that's something I kind of touched on when we're talking about diagnosis. And so for us as providers, one thing that we have to do, right, is to have hope. I think some old trainer of mine called it like we're selling hope, that this medication is going to work, or this intervention is going to work, or this hospitalization might be different, or this residential treatment might change this person's trajectory. But if we have thoughts and biases about their trajectory, we are unconsciously going to communicate our lack of hope. Whenever I see this, I see it like in things like this person is a quote unquote frequent flyer. That really bothers me, right? It's like this person is just going to keep coming in and out of the system. And so I think when we don't have hope for the people that we're serving, they know it and we know it, and it gets communicated to them as well. And so our perception about Black and Brown people, our perception about queer folks, our perception about women, about men, all those things get transmitted to the people that we're serving. I think it matters. Now, I see you asked the question, Travis. What impact has the current civil unrest on suicide? So it's interesting. There's actually been a rupture in the Okay, put it in. I'll answer at the end. Thank you, Tina. I don't want to stay on this, but why does identity matter? It matters. And I think, especially thinking actually, Tina, about the social justice summer, I think that the summer has been a reckoning. And I think that I'm seeing white folks having a different conversations with themselves. And I think that, we are all kind of trying to do better. And when you'll hear me talking about allyship later on and what that looks like. Okay, I'll get off of this side. We've been on here forever. So what happens when we pretend that identity doesn't matter? So trauma. When you are assaulted, injected with medication that's too strong, that you end up with tardive dyskinesia, permanent, people are traumatized by our healthcare system. I don't know if other people agree with me on that, but I can't help but notice, especially when I see my clients who I have a private practice and I see suicidal people in my private practice, which is very stressful for clinicians to see people who are suicidal, of course. And I do my best to keep people out of the hospital because I don't think that being held against your will sometimes is actually the last thing that is helpful. So people end up being traumatized when we're trying to be helpful. And most folks in here, or all folks in here, are doing their best. And I think nobody here wants to be part of a system that is hurting people. And so that's what happens. What happens when people are traumatized? They avoid help seeking. So we end up with people who are so much sicker, so much more symptomatic than they would be if they had felt comfortable seeking help. And I frame this because we want people to seek help on the early side of things. But if you're a person of color, you are scared of what might happen. You're scared of your child being institutionalized. You're scared of calling the police. What happens is that people just become more and more sympathetic, and that's deeply upsetting, right? And I think that when you work for many years in a field, you will find that we, and I'm going to say we, end up objectifying people. People become objects rather than individuals, like I said about the whole frequent flyer, which I've heard my whole career, or they become, I would say, the word I would use, they become like caricatures, right? They're like, oh, this is the person with schizophrenia, homeless person, right? Or this is like, they become like sort of like they blend in with each other. And when that happens to us as providers, we become burnt out. And, you know, I can't help but notice that in our healthcare system, that we are seeing more, like there's a push for productivity. More and more, you're being pushed to see more people. You're being pushed to serve more people. You're being pushed to do more documentation. And you're being pushed in this conversation to do even better and to center identity and all the things when you're just literally trying to get through the day and go home and deal with your kids who haven't finished their homework assignments, can cook dinner, and then do it all again the next day, and you don't get paid that much. So everybody is burnt out. And so in some ways, I am asking you all to do even more when you're already doing your best. So I do want to make sure that that's clear. And then we create stress on systems. People use the ER inappropriately, and all of our health insurance is gone up, and everybody has a $4,000 deductible, and it just feels like, what's the point? So, well, this is not sounding very positive. I promise it will get better. Great. Okay. So one thing I want to talk about is intersectional identities in crisis. So some like facts, right? So we know that Black and brown folks are more likely to die from heart attacks, breast cancer. We know that Black women are 4 times more likely to die in childbirth. I put these in healthcare options. I mean, like not just in psychiatric. And we know that LGBTQ youth are less likely to receive services. And I see your question. If crisis providers create a healthy treatment environment, wouldn't it make sense for them to want to come back? Yes, but this isn't happening, Travis. And I think that everybody here is doing their best, but I think this is where the allyship comes into play. And I have to say is I have been a troublemaker at work. I don't know if y'all could tell, but I am at heart a troublemaker. Here, I'm going to jump ahead of this one. And I think we have to start speaking up, and we'll talk about that in a second. So I don't know, have folks heard about the minority stress model? I stuck this in because I thought it was important for us to have a conversation about the minority stress model. This is something that at the Trevor Project we tend to use, and for folks who this might be a little bit unfamiliar, is that one thing I get asked all the time is why are Black and brown people more likely to be depressed and anxious? Why are LGBTQ folks more likely to be suicidal? And I know that it's probably obvious, but I always like to frame people, which is there's nothing inherently wrong with those different identities. People are born the way that they are, but society has created a lot of external pressure, discrimination, violence, rejection. Right now I'm in Cape Cod, and when I drive here, I feel scared. I get being pulled over by police. Especially at this current time, like the amount of anxiety I experience at being pulled over with my children in the car. And oh, I love that, Brenda. Well, I'm scared, just 100% scared that I'll get pulled over and I could be killed in front of my kids. That kind of stress a lot of Americans don't experience driving down the street. And so when you are living your life expecting the worst, and then you internalize these harmful attitudes, it actually has negative health outcome, right? More anxiety, more depression. And I always think of it as that when you have folks with intersectional, marginalized identities in the United States, everybody's cup is full. Meaning I'm at capacity. I'm parenting, and I am at full capacity. If something goes into my cup, it will spill over. And so when you're working with these people in your residences or wherever folks are working with, most of these people probably are at capacity. Exactly. Thank you for pointing that out, William. You have an intersectional identity as a parent of children of color, and it's actually a hidden identity, right? And I'm sure people say stuff to you thinking that you're going to go along with them, and they don't know. So I think that's super. So one of the things I like to also talk about during this conversation is bias, is that everybody here has bias. I have bias. So I wanted to take a moment, you don't have to drop it in the chat, to think about in your workplace setting, when have you allowed bias to impact your work? I'm gonna like literally wait 10 seconds. You don't have to drop it in the chat. I want you to think for a second about when this has happened to you, and when you've allowed it to impact your work. The example that I gave earlier is when I was working on the inpatient unit and I saw college students, my bias was to be more helpful to them. It's something that I became aware of. And, you know, those people are already having some privilege, but I felt more hope for them. Okay, so Travis, you took a risk. You took a risk and you dropped in the chat. When I see where people are from or where they went to school, right? So it sounds like if they went to a school that was more prestigious, you're more likely to think good things about them. This is something that we're trained to as Americans. That's a really great example. And I think, I think that also your identity impacts where your bias is. So if you see someone who's wearing a cross, or maybe you're more likely to feel connected to them. Great. Thank you, Amina, for being so honest. I think it's really hard to be vulnerable in this space. So as it relates to that horrible phrase, frequent flyer, and the initial thought that I can't be helped is a bias that I have struggled with. I think I really appreciate you saying that. And I think that that's also related to hopelessness, right, with our system, because we can see how people go in and out. So everybody here has bias. I have to work every day to work past it. Even when I ride the train in New York City, although I haven't ridden it forever, one thing I do is I know that unconsciously people don't sit next to Black men. And so I always sit next to Black men on the train. And I always get this look like, why is this person sitting right next to me? And I'm like, because I'm sitting next to you. So, okay, great example. If I interact with someone and I'm, okay, yes. And then you assume that something about their intelligence, 100% Lauren. Okay, so one of the things I like to talk about too, in the context of intersectionality, is microaggressions. Now we use this word, and microaggressions are essentially sort of like these nonverbal, unconscious things that we engage in. I engage in microaggressions. Everybody in this room engages in microaggressions. I think this is not the microaggression police, but it is very much like a manifestation or behavioral expression, and even crossing your arms with someone with whom you feel discomfort, things like that. All these things kind of are communicated to the people with whom you are working. And you think about it as folks who are in crisis are also vigilant. They are looking for rejection. And so I do think that in a crisis setting, in a residential setting, in an inpatient setting, these microaggressions are played out almost on like an extreme basis because your clients are looking at you and then making assumptions about who you are, what you look like, and what you think of them because they've been rejected in the past. So it's verbal communication, it's nonverbal communication, it's environmental cues. I think specifically when we think about LGBTQ folks who identify as non-binary, when they see male-female bathrooms, they're thinking to themselves, I am not welcome here. I'm not a person who's going to be seen. And so there are lots of different environmental cues. Like if I'm somewhere and I see, like I'm in a provider's office and I see only people with the same identity on the walls, I'm going to, and it's not my identity, I'm going to assume that this is not a welcome identity for me, a welcome place for me. So this is a flag. I kind of put here different microaggressions that happen in crisis settings. Is that your natural hair? Are you on Medicaid? Do you have a father? You're transgender? Wow, you don't look like it at all. Do you have a boyfriend? Why is this a potential microaggression? Because you're assuming someone's sexual orientation versus you have a partner. Do you speak English? Saying to someone who potentially presents as a not American. Now American is everything. So these are different questions that providers start out conversations with a new client and instantly are communicating to the client their bias. So, oh, thank you for, so Carrie says, years ago in the early 2000s, I encountered a Black woman as a crisis. She had hair extensions in her bag. As a white woman, I didn't understand what hair extensions were. You don't need to be embarrassed. And you know what? I'm not a fan of the Kardashians, but they have normalized fake hair in a different way. But yeah, I think I appreciate you being vulnerable and sharing that. And I imagine, Carrie, that you wouldn't have that same reaction now. And I think it's really great that you're able to see yourself then and the growth that you've had now. Great. Okay. I've talked about this. I've asked that question earlier, so I'm going to skip over that. Okay. What can you do? Oh, thanks, Amy. What can you do? Oh, gosh. I'm asking you to do more than you already do. But allyship is a verb. It's not an adjective. Meaning, if you've forgotten these terms, it's not a way that you describe yourself if you're not doing anything. It is a verb. What I'm going to ask is for people to agitate in your communities in a nice way, right? And say, hey, Bob, you just misgendered that person. Hey, Susan, I actually noticed that you asked that question, and that might make that person feel uncomfortable. I am an ally to the LGBTQ community. I'm not part of the community, but I correct people all the time when I think that they're in a nice way, I hope. Travis could probably speak to this more than anybody. But I try to be open and kind in noticing other people's behavior, because when you do that, when you stand up, especially in front of a client, because oftentimes we're like, oh, I'm gonna catch the person, quote unquote, offline. Nobody can see my air quotes. But doing it in front of a client sometimes can be really powerful experience, because they're like, oh, I am safe here. So being an ally is really a great thing that folks can do, and really starting out with looking at yourself. Specifically with the LGBTQ example, using building relationships with LGBTQ young person. Yes, exactly, Travis. Thank you. Yeah, looking at yourself and being open. I think this is such an amazing time for growth. At least for me, I people ask me, and I'll answer one of the questions in the Q&A, like, gosh, there's so much going on. Are people feeling hopeless? And there's election coming up. And I feel like this is like 1968, right? And that we are on the precipice of change, and you all are the bearers of change. Okay, so Kennard said, one of the most prevalent microaggressions I've heard is when a client are, oh, you are here again. Why are you here again? Yeah, I hear that all the time. So when you're talking about, and going back to being an ally, if you want to be an ally to a person of color, LGBT, and you don't have any of those people in your life, like everybody in this room, to think about who are their friends and family, who do they spend time with. If everybody has the same identity as you, it's going to be a real challenge for you to be an ally. I would consider this a challenge. I'm challenging everybody to look at their community and figuring out how they can be helpful. And I appreciate all the comments in the chat. 100%. Again, it's very troubling. So this is a statistic just for LGBTQ youth, right? One adult saying you're normal, you're okay. For a kid who is LGBTQ, it decreases their chance to report a suicide attempt by 40%. I want to take the moment to sink that in. If one old lady at church, if one elderly person at church, I'm gonna use my language, says it's okay, baby, God still loves you. You've just decreased their chance of suicide by 40%. And so, when we're thinking about, especially in the chat with our folks who are in crisis, you being an ally, sorry, Amina, you being an ally is something that can change the trajectory of someone's life. I think about this all the time, and sometimes I hear from clients from that I've seen 10 years ago, and they said, I didn't even think of it at the time. When you said this to me, it changed everything for me. And I wasn't able in that moment to tell you, but I'm able to tell you now. And so I do like to flag that you don't know how you can change people's lives, and it might take 2 years to simmer, but they'll get to it. Okay. So also when you're being an ally, mirroring language when the person's talking about identity, using affirming exploration. Thank you for sharing that with me. A lot of people use this term in different ways. I think what we do with our young people is you use the language that the person is using. If they're using queer, you use queer. And I think it's really helpful if you're paying attention that mirroring language makes sense. And of course, everybody here is trained to do that, to reflect. But you really, language is important, which we've been talking about. And I do agree about Marshall Linehan. Okay. I'm going to jump ahead because I think I've made my point about this. Okie. This is really about LGBTQ young people, but talking about using pronouns and things like that. That's super important. Y'all have this. I don't need to belabor the point because I want to talk about being a listener, which we were just talking about. Obviously, this is actually someone who works with the Trevor Project, and they're amazing. And really just like using empathetic listening is something that when you're in the rush to fill out paperwork can be a challenge. So I hope that this conversation encourages y'all to center yourself back in your training and in your work to do so. I have a video. I'm not playing it. This is a video like the Brené Brown about sympathy versus empathy. I'm sure folks have seen this before. I'm not going to play it. I just put this picture up because it is one of my favorite videos. I love Brené Brown. And I think that she's done a really important work around sympathy versus empathy and talking to people. So if you have a YouTube, just do sympathy versus empathy, Brené Brown, watch this video. It is amazing. Me too. Okay. And so here, oh, good. I'm right on time. You can go to our website. Our website is in the process of being revitalized. So just keep in mind that we know it's a little wonky. So give us in April, I think the new one is coming out. But I do want to jump to our Q&A and kind of just jump back to some of the questions. And so if you have any questions, please pop it into the Q&A because I'm going to pop out of the chat. Oh, thank you, Ilan. I'm going to pop out of the chat and I'm going to go into the Q&A and ask any questions. And I'm going to start with Travis. What can crisis providers do to address racial equity in employing people who look like? Ooh, that's an interesting question. So I can tell you what we're doing at Trevor. This is actually an ongoing conversation. Oh, Rania, you can pop out. Should I turn on my camera?
Yeah, let's try to, yes, we'd love for you to have your camera on and we can share some of the questions that have come through. This has been great.
Okay, great.
Dr. Dole, Tia. Thank you for challenging us. I have to reiterate, somebody said in the chat, language is very important. For me, I'll take away conversion efforts instead of conversion therapy. So thank you for educating and challenging us. When I think of change, that word challenge comes up a lot. And I think it takes a lot of courage, whether it be challenging yourself or challenging the environment you're in. You have to be brave. There's definitely a lot of work to be done, and it's not work that will only be done this year. I think we're really signing up for lifelong work in this area. All right. Yeah, so
I mean, so should I jump in? Are you? I think I said I was going to manage it. Is that okay, Rania? Or
sure, go ahead.
Okay, yay. Oh, I think there's like a publish option. I don't know how to do that. You might have to do that. So Travis asked, what can you want to do? You'll do the publishing thing.
Yeah, I'll go ahead and I can read the questions to you and you can go ahead and answer them.
Okay, great.
All right, so Travis's question, I'm going ahead and looking for it because you had scrolled up for it, right? I believe he asked about equity. Recruitment, yes, and equity. Yeah. So what can crisis providers do to address racial equity in employing people that look like the people they are treating? Treating.
Okay. So I'm going to say this is a two-pronged issue. So first, it starts actually on the training side. We need folks who are going to school to serve other people. And part of the issue, oh gosh, I hate seeing myself. Part of the issue is that, not enough people go into training programs. I know that, let's say I'm a clinical psychologist, something like 2 or 3% are Black, like 0.5% are identify as Latinx, something along those lines with Asian. And part of it is because we want a traditional trajectory for folks who are going into training programs. And I'll speak specifically about psychologists, is that we want someone who has a 4.0, and then you have to have research. And then, we don't take into account that having someone who has straight A's and comes from a typical background may not necessarily be the only type of good therapist that there is. So that's number one, is training. For us at Trevor, we talk about this all the time. And specifically, it's actually building out pipelines and recruitment. A lot of times when you're working for an organization or a hospital or residential, recruitment is sort of passive. You publish it on Indeed, you put it on LinkedIn, and then you say, well, these are the people that have applied for this role. It is what it is. But what you don't do is actually go to sort of more non-traditional routes, going to HBCU, which is the historically Black colleges or universities, or going to other places where you might find more diverse candidates who aren't necessarily using Indeed or not using LinkedIn, and building out those pipelines. And one thing that we do at the Trevor Project specifically is, right now we're in the middle of hiring for a role where we're going to hire 10 people for the same job. And what I've said is as an executive in this vertical, I need a diverse slate of candidates, not just about race, not just about orientation, but also gender identity. And I want a bunch of, kids who come from Ivy League college. I want people to have the opportunity to work together. So it's my role as a leader in my organization to say, I'm not going to interview people who all have the same identity. I won't. And that again becomes back to the idea of being disruptive. Ooh, can y'all hear me? Mm. Can you all, I hope everybody can hear me. This one kind of went dead for me. I will, I'll continue to ask questions. I assume that folks can hear me. Can y'all hear me? Can you all, hello? I'm going to assume that we are okay. And then I will turn off my video just in case of creating some issue. Turn camera off. Okay. The next question I have here is, let's see. I want to jump ahead, Travis. I'm going to skip you. What the events of this past summer and in on the fight for Black lives? How do we as Black people show grace, not frustration, that has taken this long and this much trauma to bring more people to the table? I love this question, and I think this is like super interesting to me because grace is such a clear concept, also a concept that we don't necessarily talk about. And how do we show grace? I think we've been showing grace, and I say this as a Black person. I actually think that it's not us right now. I actually think that a white allyship matters more than Black grace. I don't know if I'm answering your question, but I think that grace matters because it's not healthy for us to hold on to rage. What is that famous saying? Like, bitterness is like holding your breath and waiting for the other person to die. And so grace benefits you as an individual. But I think in this movement, white allyship is what matters most. And I think there is no timeline for grace. It might take 20 years, it might take 20 minutes. And I think that we as Black people, I'll get off my soapbox, we as Black people have done our part and I'm actually really excited about the allyship that's coming, even in the LGBTQ community. I think this summer was like a reckoning, even in the LGBTQ community, where Black and brown folks in the community were like, hey, we've been unseen. We've been here, but y'all haven't seen us. And what does that mean? And the white allies in the LGBTQ community have said, oh, we need to do better. we have not seen, especially when you're talking about Black trans folks. And so, Rania, you asked the question, what impact has the civil unrest? We actually haven't seen an uptick in suicidality with Trevor Project folks. They're actually, we see kids, and so they're stressed about their parents. They're terrified of getting their parents sick. A lot of people live with their grandparents, things like that. And so they're more concerned, not so much about COVID, for instance, but they're concerned about how can I protest safely. They're more concerned about physical safety from police and things like that if they engage in agitation. So they haven't been more suicidal, although I have to say that this is across the board with the National Lifeline, CTL. All of the places are not seeing an uptick in suicidality, and it's left everybody scratching their heads. And folks are saying to themselves, this is coming. Like, there's a sense that sort of like 40 million people just lost their jobs. When foreclosures start to happen, people start to lose their home. That's when you're going to see the impact on young people. So that's sort of what we anticipate. Okay. I'm going to jump in another question. I'm going to make sure I have a diverse. Okay, I like this question, Laura. How do we remain genuinely curious and trying to understand while avoiding further fatiguing LGBTQ folks with having to continually and constantly feel responsible to educate us? How do you stay curious? Well, first of all, I'd like to acknowledge in your comment is a sense of exhaustion. And I think that I think everybody is super fatigued, and I understand that part of the conversation yesterday was about self-care, and what does that mean? And I think, how do you stay curious? Whew, gosh, I think it actually is understanding that if the work is never going to be done, you're going to see my bias during this, but the United States was built on slavery, right? We as Americans, and I'm an American, and been American for generations, right? We've been inculcated into our system. And so to dismantle, undo the way that we perceive each other, I think is not something that's going to take 6 months. It's going to be a lifetime conversation that you have with yourself, in the way that things constantly come back. So there's so much writing, articles, and movies, and there's enough materials that you as an individual, especially as a white individual, can put yourself out there without sort of leaning on your colleagues or your friends, things like that. I see, Rania, I see what you're doing. You're putting it into the chat. Great. What suggestions do you have for helping with working children who are Black within our school system? Oof. I used to be a school teacher, FYI, and I stopped being a school teacher because I felt so frustrated with the system. I think that the first thing that we have to do is see how they are treated. And you can see, it's so funny because there have been tons of research about differential treatment for children of color, boys versus girls in math and science classes. Like, even when teachers know that they're being observed, this is what the research shows. Even when people know that they're being observed, they still engage in biased behavior. It's like ingrained in us. And so, at least from my perspective, it really is about keeping your eyes open and noticing when things are going on and stepping in and saying something. There's like a saying when you ride the train in New York City, if you see something, say something. And I think that people think being nice means that you don't create problems or you don't stand up to people. And I said this earlier, I don't want to belabor the point, but you have to say something when you see something, and stand up for those Black children. So that's my response. I think that's all the questions, Rania.
It looks like it is. This has been a wonderful presentation. And I know Dr. Dole, you had shared that you are open to any of our attendees contacting you with further questions.
For sure.
So feel free. We have shared Dr. Dole's contact information on the screen. And I just want to thank you once again for joining us and providing us with this wonderful education, and then also challenging us in different ways today.
Thank you. It was a pleasure being here, and I look forward to seeing the other presentations. If people have any questions, also constructive criticism, please do put it into the survey. I always am looking for ways to grow and learn. And it's not, even though this is like a virtual room, it's not a one-directional conversation.